We will be filming the presentations and the activities later, so if you would prefer not to be filmed, even if it is from the back, feel free to move to the back of the room, and then we'll make sure you're not captured. So we're just going to begin. Firstly, thank you all for coming this afternoon. I think we've escaped most of the rain. I also wanted to say thank you for remembering that it was at the football club and not at the Barnabas Centre. So we just want to send our best wishes to everyone who works in and looks after the Barnabas Centre, because they were affected by the flood. So today it's about having an opportunity to highlight the work that's being done across Shropshire at the moment. Okay, so we're going to start with some presentations from a range of speakers, and so it's about hearing the work that they're doing and the difference that they're making, and they've all been asked to provide a case study or an example from practice about how they've made an impact on someone's life. I also wanted to mention that today's event is supported by the whole of the Healthwatch Shropshire staff team. We're all part-time, and some of them have given up their own time this afternoon in order to be here, so I really appreciate that. But also we've got members of our board here and some of our volunteers. So the first little bit I'm just going to do is just give you a very brief background about Healthwatch Shropshire and this event, so you can see where we're coming from. So I'm sure most of you know this already, but we were set up by the Health and Social Care Act in 2012. Every local authority area has to have a Health Watch, and there is Healthwatch England who try and make sure that we're all doing things in the same way and we're all doing what we need to do and having an impact. Our whole role really is to find out what matters to people and to make sure their views are heard and that they can impact on the development of services. So it's really key that people will share their views with us about health and social care. Really, we should be called Health and Social Care Watch and not just Health Watch, but it's not quite as catchy. And we gather those comments anonymously, which means a lot of people feel more confident talking to us, because sometimes people worry that they might lose services if they give any negative feedback. We're also keen to hear positive stories, because a lot of good work does happen across the county. A lot of people are working really hard to deliver some really good services. We make sure that we share that feedback from people with the people who need to hear it, so that's the people who provide services, the people who regulate those services like the Care Quality Commission and NHS England in improvement, and obviously with the commissioners locally, so with Shropshire Council and the Clinical Commissioning Group. We also offer a signposting service, so if people don't know what services are available in the county, we can point them in the right direction. And we also want to provide people with information, so that's any public information about services that are available, but also how to stay well and healthy, and also get involved when people are asking questions about services. And so it's really important to us that we involve people, and we couldn't do what we do without our volunteers and our board members. So we're constantly recruiting for both. So if you know of anyone who's interested in doing some volunteering, please suggest that they speak to us about the opportunities available. And at the break, my colleague Ali will be out at our stand if you've got any questions about volunteering or becoming a board member. So today, why today? So I'm sure everyone's familiar with the fact that in January 2019, the NHS long-term plan was published. And after that, Healthwatch England asked all local Healthwatch to speak to members of the public about what they thought services should look like in the future. And we wanted to give people as many opportunities as we could to feedback, so we did questionnaires and focus groups. And in Shropshire, Healthwatch Shropshire were the coordinating Healthwatch, and we worked with Healthwatch Telford and Wrekin. And between us, we heard from 641 views, which was really great. And we were able to feed back our report to the local Sustainability and Transformation Partnership, who were involved in putting our local plan together. So, in terms of today and why we're looking at things like prevention and self-care, is prevention is a key part of the NHS long-term plan, and therefore a key part, inevitably, of the Shropshire, Telford and Wrekin long-term plan. And it's important to think about how we can all work together to support people's health and well-being, rather than maybe just relying on one provider or one service to do that for us, such as the NHS. So in Shropshire, Telford and Wrekin, prevention is one of our key priorities, and so you'll see on the right how it's described to develop a system approach to improve well-being, physical and mental health, and reduce health inequality. So today was really then about how we show some of the work that's already happening, because even though that plan locally hasn't been published yet, it hasn't been approved yet, there's already a lot of work that's happening that will contribute to that. When we spoke to people, some of the things they told us will lead to some of this work on prevention being seen to be so important. So people told us they wanted to know what support is available across Shropshire, not only from services but also within their own communities. They wanted information, reliable, consistent information about how to stay well, because there's so much conflicting information out there. They wanted help to make the right decisions about how to stay fit and keep healthy. And they wanted services to work more closely together. And that includes sharing information and just communicating better amongst services. And so some of the pieces of work we're going to hear about today are a good way of demonstrating how some services are working together. So what we're going to do, we're going to hear from Jackie Jeffrey about the Advice, Advocacy and Welfare Benefits Service, Les Clark about Sustain Housing, Daphne Simmons about the Wellbeing and Independence Partnership, Laurel and Penny about social prescribing in Shropshire, and Dr. Finola Lynch about Shropshire Care Closer to Home. And hopefully, if it all runs smoothly, we'll also be followed by a short question and answer. But I will say, if we haven't got an enormous amount of time for that, if you do have a question and you haven't had the chance to ask it, please speak to the speakers at the break, and they will either do their best to answer you or get back to you with the answer. Is that all right? Any questions? Okay, so let's start with our first speaker. Jackie for the Advice, Advocacy and Welfare Benefits Service.